Thank you for your interest in Covenant HealthCare. I'm Beth Charlton, President and CEO of Covenant HealthCare. I've worked here for over 32 years, and I want you to know that I started right where you did, literally sitting in preparing myself for an interview and an onboarding process in this fantastic organization. I started, as I mentioned, as a student nurse extern many years ago, and have had great opportunity to work in a host and variety of many positions since that time. I've worked in pediatric critical care, adult critical care, cardiology, progressive care. I've even had the opportunity to work in information technology. I've also had the good fortune to be able to work in a host of leadership positions, ranging from a nurse manager to a director of nursing, the vice president of patient services, our executive vice president and chief operating officer. I am living proof that the opportunities are absolutely boundless here at Covenant HealthCare, and I couldn't be more proud of the fact that you are sitting here having this conversation, watching this video, and engaging to learn more about what Covenant has to offer. There's something very special about Covenant that sets it apart from other institutions, and I want to tell you a little bit about that and find out whether or not you could potentially be a good fit for this organization. Covenant is an extraordinary place that, as its mission states, provides extraordinary care for every generation. So what that means is there's a few things that I think are important for you to know about Covenant. Covenant is the result of an extraordinary merger that happened over 20 years ago and that now provides service in a host of different ways across the care continuum. We provide care for over 30,000 patient discharges. We provide extraordinary care for 3,000 births annually. We have a regional neonatal unit that has 55 beds dedicated to some of the sickest premature infants and babies in the state of Michigan, and we're extremely proud of that. We also have a level 2 adult and pediatric trauma center here at Covenant, which also is supplemented by a helicopter service and multiple means to be able to provide extraordinary care amongst a host of clinical patient populations. In addition, we do many things outside the four walls proper of the hospital. So many people think about the hospital as being the four walls here. We have urgent care centers, physician office practices, and a host of various centers, both on campus and off campus, where we provide ambulatory, outpatient, and physician office support and practice and care. So Covenant is an extraordinarily large place that also gives over 1 million patient touches annually. So think about the capability that you have as an extraordinary team member to be able to provide great depth and breadth and an opportunity to be able to highly impact the community in which we live. I would also like to share with you the tremendous way in which we work and accomplish care here in the organization. We've been designated multiple times as award-winning in what I consider are the pillars of care delivery. So whether that's a quality award or a patient experience award, fiscal, absolute, solid nature, or just, again, employee engagement for the way that we live and work in our community, we are recognized as award-winning in each of these categories, separately and as a collective whole. Without a doubt, the difference at Covenant is the extraordinary nature of the people. The people are, without a doubt, the most fundamental and best resource that we have here. That, coupled with a culture that is embodied on core values and beliefs and a way to provide extraordinary care to the community and to the patients and families that we serve, literally is what sets Covenant apart. So I want to talk a little bit more about that. Our mission at Covenant HealthCare is extraordinary care for every generation. What that means is the extraordinary part of extraordinary care is, again, the people. The way that you provide care makes the difference here at Covenant. So what we've done is we've taken a specific acronym called We Care, which has specific values and a particular way we want people to work here at Covenant to embody the culture and embody the nature of the care that we give to patients and families and to one another and the respect that we give to one another. So those values are listed, as I mentioned, in the We Care acronym. So the W in We Care stands for working together. You cannot do what needs to be done in providing stellar care to patients and families and to our community without teamwork. So teamwork is a very fundamental part of the way that we work here. Excellence, the E. Excellence speaks to the way that we work and go about the nature of our business here and our roles specific at Covenant. So being, okay isn't good enough. Really wanting to stand out and make a difference in the way that you approach your work and what you contribute every single day is extraordinarily important. So in addition to that, the care is the C stands for what we call customer service, and I would even maybe call it patient experience and customer service. So again, the approach and the way that you handle what you do in terms of what you contribute to your work for ultimately the patient or a team member, et cetera, you do that in an extraordinarily high quality and very, very focused way. So that's another one of the elements. The A in the care portion of the We Care acronym is about accountability. And what accountability means is that you're really responsible for the work that you're providing. You have a positive, proactive approach and a committed approach towards what you're giving every single day to the organization and ultimately to the patients and families that we serve. In addition, the R is for respect. Again, treat others as you would want yourself to be treated is the way, that golden rule is the way that we live here at Covenant, and it's a very fundamental part of our value orientation. And then lastly, the E. The E is for enthusiasm, because bottom line is we want you to be passionate about the work that you're providing here. So a job can be just a job, or a job can be a passion for which you want to make a positive difference in the lives of the team members that you work with, the patients, the families, and the communities that we serve. So those We Care values, if that's a match for the characteristics that you hold and possess as a person, you're the kind of team member we want to consider a position at Covenant. So I guess what I would like to do is close by saying, at least right now, that if this inspires you to be a part of our extraordinary team, we want you to continue on in this employment process, and please consider being a member of our extraordinary work and our team members. So again, welcome to the process.
Hello, I'm Kevin Birchmeyer. I'm the Executive Vice President and Chief Operating Officer here at Covenant HealthCare, and thank you for your interest in joining our extraordinary team here at Covenant. I love to work at Covenant HealthCare because you have a great opportunity to help the people of our community in the Great Lakes Bay region. We affect over 1 million people a year. It's our caring culture that leads us to achieving our mission of extraordinary care for every generation. Thank you.
What makes me proud is the positive contribution that Covenant has in the community. But behind that contribution are the staff and our leaders who help the staff get to their goal.
I love working with the security team because we are a big family.
I love working at Covenant HealthCare. I get to learn new things every day, really good benefits, and it works out my school schedule for sure.
I love being a volunteer here at Covenant because it gives me the opportunity to serve, to meet great people, and make the other people that are coming in feel welcomed.
I love working at Covenant HealthCare for the joy of taking care of my patients.
I love working for Covenant because of their flexibility and their investment in me.
After 45 years, I still enjoy coming to work because of my coworkers.
We hope you'll join our team here at Covenant HealthCare.
I love working at Covenant HealthCare because we live out our We Care values.
I love working at Covenant because of the team atmosphere.
We hope you'll join our team.
Come join our team.
We hope you'll join our team.
Come join our team.
You've heard a lot about what makes Covenant HealthCare unique and special. I'm really excited that you've taken an opportunity to listen and learn more about us. If you have found something exciting, something that you can be passionate about, we very much want you to consider being part of the Covenant team. And I would look very forward, number one, to you continuing along this process, and number two, seeing you around going forward. Thank you for taking the time with us today, and I look forward to seeing you here at Covenant HealthCare. Thank you.